Welcome to MCQs Master 101. In today's video, we'll tackle 50 NCLEX renal questions with confusing answers explained. These are high-yield exam-style questions designed to sharpen your clinical reasoning, improve your test-taking skills, and help you avoid common NCLEX traps. Let's get started.
Question 1. A client with acute glomerulonephritis presents with cola-colored urine, periorbital edema, and BP 168/94 millimeters of mercury. Which finding requires immediate intervention? A. Urine output of 35 milliliters per hour. B. Proteinuria 2+. C. Serum potassium 6.2 milliequivalents per liter. D. Mild headache. Answer. C. Serum potassium 6.2 milliequivalents per liter. Rationale. Hyperkalemia is life-threatening due to risk of cardiac dysrhythmias. The other findings are expected in glomerulonephritis. Question 2. A client with chronic kidney disease, CKD, is prescribed a low-protein diet. What is the primary rationale for this restriction? A. Prevent fluid overload. B. Reduce nitrogenous waste buildup. C. Improve sodium balance. D. Decrease potassium. Answer. B. Reduce nitrogenous waste buildup. Rationale. Protein metabolism produces urea. Limiting protein reduces uremic toxin accumulation in CKD. Question 3. A client undergoing hemodialysis reports headache, nausea, and confusion during treatment. What is the priority action? A. Slow the dialysis rate. B. Administer antiemetic. C. Increase dialysate flow. D. Stop dialysis immediately. Answer. A. Slow the dialysis rate. Rationale. Symptoms suggest dialysis disequilibrium syndrome. Slowing fluid and solute removal helps prevent cerebral edema. Question 4. Which laboratory finding is most consistent with end-stage renal disease, ESRD? A. Hemoglobin 15 grams per deciliter. B. Creatinine 0.9 milligrams per deciliter. C. Calcium 7.8 milligrams per deciliter. D. Phosphate 2.5 milligrams per deciliter. Answer. C. Calcium 7.8 milligrams per deciliter. Rationale. Hypocalcemia occurs due to impaired vitamin D activation and phosphate retention. Question 5. A client with nephrotic syndrome has generalized edema and albumin 2.0 grams per deciliter. Which intervention is most appropriate? A. Encourage high sodium intake. B. Administer IV albumin. C. Restrict fluids completely. D. Increase protein unrestricted. Answer. B. Administer IV albumin. Rationale. IV albumin increases oncotic pressure, pulling fluid back into circulation. Question 6. A nurse is assessing a client with acute tubular necrosis, ATN. Which phase is associated with the greatest risk for fluid overload? A. Initiation phase. B. Oliguric phase. C. Diuretic phase. D. Recovery phase. Answer. B. Oliguric phase. Rationale. Reduced urine output leads to fluid retention and overload risk. Question 7. A client with CKD has potassium 5.8 milliequivalents per liter. Which food should the nurse instruct the client to avoid? A. Apple. B. Rice. C. Banana. D. White bread. Answer. C. Banana. Rationale. Bananas are high in potassium and worsen hyperkalemia. Question 8. Which assessment finding indicates a complication of peritoneal dialysis? A. Clear dialysate outflow. B. Mild abdominal discomfort. C. Cloudy dialysate. D. Warm dialysate infusion. Answer: C. Cloudy dialysate. Rationale: cloudy effluent suggests peritonitis, a serious complication. Question 9. A client with renal calculi reports severe flank pain radiating to the groin. What is the priority nursing action? A. Encourage ambulation. B. Administer analgesics. C. Increase oral fluids. D. Strain urine. Answer: B. Administer analgesics. Rationale: pain control is priority. Renal colic pain is severe and requires immediate relief. Question 10. A client with CKD is receiving erythropoietin. Which outcome indicates effectiveness? A. Increased potassium levels. B. Increased hemoglobin. C. Decreased creatinine. D. Reduced edema. Answer: B. Increased hemoglobin. Rationale: erythropoietin stimulates RBC production, correcting anemia. Question 11. A client with CKD has the following lab values. Which requires immediate action? A. BUN 48 mg per deciliter. B. Creatinine 3.6 mg per deciliter. C. Potassium 6.0 milliequivalents per liter. D. Hemoglobin 9.8 grams per deciliter. Answer: C. Potassium 6.0 milliequivalents per liter. Rationale: hyperkalemia is immediately life-threatening due to risk of fatal arrhythmias. Others reflect chronic disease.
Question 12. A client returns from kidney biopsy. Which finding requires immediate intervention? A. Hematuria. B. Flank pain. C. BP 88/54 millimeters of mercury. D. Bruising at site. Answer: C. BP 88/54 millimeters of mercury. Rationale: hypotension indicates possible hemorrhage, a life-threatening complication post-biopsy. Question 13. A client with acute kidney injury, AKI, has urine output of 20 milliliters per hour. Which order should the nurse question? A. IV furosemide. B. Calcium supplement. C. Fluid restriction. D. Daily weights. Answer: B. Potassium supplement. Rationale: AKI causes potassium retention. Supplementation can trigger dangerous hyperkalemia. Question 14. Which finding in a client with nephritic syndrome is most concerning? A. Mild proteinuria. B. RBC casts in urine. C. BP 170/100 millimeters of mercury. D. Periorbital edema. Answer: C. BP 170/100 millimeters of mercury. Rationale: severe hypertension can lead to stroke or organ damage. Others are expected findings. Question 15. A client on hemodialysis suddenly develops chest pain and dyspnea. What is the priority action? A. Continue dialysis. B. Slow blood flow rate. C. Stop dialysis immediately. D. Administer fluids. Answer: C. Stop dialysis immediately. Rationale: symptoms suggest air embolism or cardiac complication. Dialysis must be stopped immediately. Question 16. A client with CKD is prescribed calcium carbonate. What is the primary purpose? A. Lower potassium levels. B. Bind phosphate in the gut. C. Increase hemoglobin. D. Promote diuresis. Answer: B. Bind phosphate in the gut. Rationale: calcium carbonate acts as a phosphate binder to reduce hyperphosphatemia.
Question 17. A client with AKI enters the diuretic phase. Which finding requires closest monitoring? A. Hyperkalemia. B. Fluid overload. C. Hypokalemia. D. Hypertension. Answer: C. Hypokalemia. Rationale: excessive urine output leads to electrolyte loss, especially potassium. Question 18. A nurse is caring for a client with a newly created AV fistula. Which finding is most concerning? A. Palpable thrill. B. Audible bruit. C. Cool pale fingers. D. Mild swelling. Answer: C. Cool pale fingers. Rationale: indicates impaired circulation, Steele syndrome, requiring immediate attention. Question 19. A client with nephrotic syndrome is at highest risk for which complication? A. Bleeding. B. Infection. C. Hypernatremia. D. Respiratory alkalosis. Answer: B. Infection. Rationale: loss of immunoglobulins in urine increases infection risk. Question 20. A client with CKD has metabolic acidosis. Which mechanism explains this condition? A. Increased bicarbonate retention. B. Decreased hydrogen ion excretion. C. Increased sodium reabsorption. D. Decreased potassium excretion. Answer: B. Decreased hydrogen ion excretion. Rationale: kidneys fail to excrete acid, leading to metabolic acidosis. Question 21. A client with CKD presents with muscle weakness and peaked T waves on ECG. Which action is priority? A. Administer sodium bicarbonate. B. Administer IV calcium gluconate. C. Restrict fluids. D. Give loop diuretic. Answer: B. Administer IV calcium gluconate. Rationale: calcium gluconate stabilizes cardiac membranes in hyperkalemia. Immediate life-saving intervention. Question 22. A client undergoing peritoneal dialysis reports abdominal pain and fever. What is the nurse's first action? A. Administer antibiotics. B. Stop dialysis. C. Obtain dialysate sample for culture. D. Increase dwell time. Answer: C. Obtain dialysate sample for culture. Rationale: suspected peritonitis requires confirmation before treatment. Culture guides therapy.
Question 23. A client with AKI has gained 2 kilograms in 24 hours. What is the most accurate interpretation? A. Increased muscle mass. B. Fluid retention. C. Improved kidney function. D. Dehydration. Answer: B. Fluid retention. Rationale: rapid weight gain reflects fluid accumulation, not true tissue gain. Question 24. A client with CKD has phosphate level of 6.5 milligrams per deciliter. Which intervention is most appropriate? A. Increased dairy intake. B. Administer phosphate binders. C. Encourage vitamin D restriction. D. Provide potassium supplements. Answer: B. Administer phosphate binders. Rationale:
Hyperphosphatemia is treated by binding phosphate in the GI tract. Question 25. Which finding in a client receiving hemodialysis indicates disequilibrium syndrome? A. Hypotension. B. Muscle cramps. C. Confusion and seizures. D. Nausea. Answer C. Confusion and seizures. Rationale. Neurological symptoms indicate cerebral edema from rapid solute removal. Question 26. A client with nephrotic syndrome has severe edema. Which diuretic response requires immediate action? A. Weight loss of 1 kilogram per day. B. Urine output 2,000 milliliters per day. C. BP 86/50 millimeters per mercury. D. Reduced edema. Answer C. BP 86/50 millimeters per mercury. Rationale. Hypotension suggests excessive fluid removal or volume depletion. Question 28. A client with renal failure has metabolic acidosis. Which ABG finding is expected? A. pH 7.48. B. HCO3 - 30 milliequivalents per liter. C. pH 7.30. D. PaCO2 30 millimeters per mercury. Answer C. pH 7.30. Rationale. Metabolic acidosis results in decreased pH. Question 29. A client with an AV fistula should avoid which action? A. Checking for thrill daily. B. Sleeping on the affected arm. C. Keeping site clean. D. Reporting absence of bruit. Answer B. Sleeping on the affected arm. Rationale. Pressure can occlude blood flow and damage the fistula. Question 30. A client with CKD develops pruritus. What is the most appropriate intervention? A. Hot showers. B. Apply moisturizing lotion. C. Increase protein intake. D. Restrict fluids. Answer B. Apply moisturizing lotion. Rationale. Uremic pruritus is relieved with skin hydration. Hot water worsens dryness. Question 31. A client with CKD has the following findings, which requires immediate intervention. A. Pruritus. B. Hemoglobin 8.5 grams per deciliter. C. Potassium 6.3 milliequivalents per liter. D. Creatinine 4.0 milligrams per deciliter. Answer C. Potassium 6.3 milliequivalents per liter. Rationale. Severe hyperkalemia poses immediate risk for cardiac arrest. Others are chronic findings. Question 32. A client post-hemodialysis reports dizziness and BP 90/58 millimeters mercury. What is the priority action? A. Administer antihypertensive. B. Place client in Trendelenburg position. C. Give IV fluids. D. Recheck BP in 1 hour. Answer C. Give IV fluids. Rationale. Hypotension after dialysis is due to fluid removal. Volume replacement is priority. Question 33. A client with AKI is in the oliguric phase. Which finding is expected? A. Urine output 3,000 milliliters per day. B. Hyperkalemia. C. Hypokalemia. D. Metabolic alkalosis. Answer B. Hyperkalemia. Rationale. Reduced urine output leads to potassium retention. Question 34. A client with nephritic syndrome develops sudden shortness of breath and crackles. What is the priority intervention? A. Restrict protein. B. Administer diuretics. C. Encourage fluids. D. Monitor urine output. Answer B. Administer diuretics. Rationale. Fluid overload causing pulmonary edema requires immediate diuresis. Question 35. Which finding indicates improvement in a client with AKI? A. Creatinine increasing. B. Urine output rising to 1500 milliliters per day. C. Potassium 6.0 milliequivalents per liter. D. BUN increasing. Answer: B. Urine output rising to 1500 milliliters per day. Rationale: increased urine output indicates recovery, diuretic phase.
Question 36. A client on peritoneal dialysis has clear effluent but complains of abdominal fullness. What is the best action? A. Stop dialysis. B. Slow infusion rate. C. Administer antibiotics. D. Notify provider immediately. Answer: B. Slow infusion rate. Rationale: fullness is common. Slowing infusion improves comfort. Question 37. A client with CKD has metabolic acidosis. Which compensation is expected? A. Decreased respiratory rate. B. Increased respiratory rate. C. Increased bicarbonate retention. D. Decreased hydrogen ions. Answer: B. Increased respiratory rate. Rationale: respiratory system compensates by blowing off CO2, Kussmaul respirations. Question 38. A client with renal calculi is encouraged to increase fluids. What is the goal urine output? A. 500 milliliters per day. B. 1000 milliliters per day. C. 2000 to 3000 milliliters per day. D. 4000 milliliters per day. Answer: C. 2000 to 3000 milliliters per day. Rationale: high urine volume helps prevent stone formation. Question 39. A client with CKD is taking aluminum hydroxide. What indicates a complication? A. Constipation. B. Confusion. C. Decreased phosphate. D. Normal calcium. Answer: B. Confusion. Rationale: aluminum toxicity can cause neurological symptoms. Question 40. A client with ESRD misses a dialysis session. Which finding is most concerning? A. Fatigue. B. Edema. C. Potassium 6.5 milliequivalents per liter. D. Nausea. Answer: C. Potassium 6.5 milliequivalents per liter. Rationale: severe hyperkalemia can rapidly lead to fatal arrhythmias. Question 41. A client with CKD has potassium 6.4 milliequivalents per liter and is receiving IV insulin with glucose. What is the purpose of this therapy? A. Remove potassium from the body. B. Stabilize cardiac membrane. C. Shift potassium into cells. D. Increase renal excretion. Answer: C. Shift potassium into cells. Rationale: insulin drives potassium intracellularly, temporarily lowering serum levels. Question 42. A client undergoing hemodialysis suddenly develops shortness of breath and chest pain. Which is the priority action? A. Slow dialysis. B. Administer oxygen. C. Stop dialysis. D. Check vital signs. The answer is C. Stop dialysis. Rationale: suspected air embolism or severe complication requires immediate termination of dialysis. Question 43. A client with AKI has metabolic acidosis. Which medication is anticipated? A. Sodium bicarbonate. B. Potassium chloride. C. Calcium gluconate. D. Furosemide. The answer is A. Sodium bicarbonate. Rationale: corrects acidosis by buffering excess hydrogen ions. Question 44. A client with nephrotic syndrome has 4+ proteinuria. What is the most serious complication? A. Dehydration. B. Infection. C. Hypertension. D. Bradycardia. The answer is B. Infection. Rationale. Loss of immunoglobulins increases susceptibility to infection. Question 45. A client post-kidney transplant has decreased urine output and rising creatinine. What is the priority concern? A. Dehydration. B. Acute rejection. C. Infection. D. Medication side effect. The answer is B. Acute rejection. Rationale. Early signs of rejection include oliguria and rising creatinine. Question 46. A client with CKD is prescribed a fluid restriction. Which statement indicates understanding? A. I will drink fluids only when thirsty. B. I will include soups and ice cream in my fluid count. C. I can drink unlimited water if I avoid salt. D. Only beverages count as fluids. The answer is B. I will include soups and ice cream in my fluid count.
Question 47. A client with renal failure has ECG changes. Which electrolyte imbalance is most likely? A. Hypokalemia. B. Hyperkalemia. C. Hypercalcemia. D. Hyponatremia. Answer B. Hyperkalemia. Rationale. Renal failure commonly causes potassium retention, leading to ECG changes. Question 48. A client on peritoneal dialysis has outflow less than inflow. What is the priority action? A. Increase dwell time. B. Reposition the client. C. Notify provider. D. Stop dialysis. Answer B. Reposition the client. Rationale. Poor outflow is often due to catheter position. Repositioning is first line. Question 49. A client with CKD develops anemia. What is the primary cause? A. Blood loss. B. Iron deficiency. C. Decreased erythropoietin production. D. Increased RBC destruction. Answer C. Decreased erythropoietin production. Rationale. Diseased kidneys fail to produce erythropoietin needed for RBC production. Question 50. A client with ESRD has the following findings. Which requires priority intervention? A. BUN 60 mg per deciliter. B. Creatinine 5.2 mg per deciliter. C. Potassium 6.8 milliequivalents per liter. D. Phosphate 5.5 mg per deciliter. Answer C. Potassium 6.8 milliequivalents per liter. Rationale. Severe hyperkalemia is immediately life-threatening due to risk of cardiac arrest.
Thanks for watching. If you found this video helpful, like, subscribe, and turn on the notification bell so you never miss our latest NCLEX practice questions. Share this video with fellow nursing students, and let us know your score in the comments. See you in the next NCLEX Mastery session.